may know, I've been working in Indonesia conducting the assessment, the national-based dialogue assessment for Indonesia. And today we will have, discuss a little bit, and this is the easier part of the day, before we actually launch into the costing exercise. So you may remember Valerie has this during her presentation, and this is where we are now. We have addressed the first, second, and third, more or less, during our exercises and presentations. But then the next step would be, we want to know how much would it cost today and in the future when we want to fill the gap of social protection floor. And after we know how much it costs, we would like to know whether we can sell this to the government, whether the government would be interested. And the first question they would ask, naturally, would be, can the government afford it? Can we, or do we need to increase the fiscal space? Or what, in terms of monetary value, what is this, how is this going to look like? So we will mainly discuss the middle part for today. And we'll start with making the scenarios and translating the recommendation that we have discussed yesterday into scenarios. These are the steps that we'll do. First, we have a short review of the assessment matrix and see how one connects with the other. And then we need to decide which recommendation that we would like to cost, or do we need to cost. And I will bring some examples from Indonesia. Then we need to translate the costable recommendation into costing scenarios. And scenarios come with assumptions. These assumptions, some are easy, some are not so easy, and we'll discuss that. First, we see the matrix that we have been discussing over and over. And for this part, we'll mainly address the last two columns, because we have discussed and did exercise on how we see the government strategy, existing provisions, and identifying the gaps for each guarantee. And then we come up with recommendations how to fill the gaps that we found. Now we need to see how we will go further in costing it and making scenarios for costing. Or in the case of Indonesia, this is how it looks like, because then we have general recommendation and guarantee, recommendation per guarantee, but it's more or less the same method. Now, as Valerie has mentioned, we have two types of recommendation. The one that we can use the RA protocol to cost it, and the one that we don't need or we cannot cost, or cannot cost yet. So we first need to distinguish between the two. Which recommendations can we cost, and or can we cost immediately, or do we need further information, or which recommendation that we don't need to cost at all. Then comes the second question, which recommendation do we cost? As you can see, you have a list of recommendations, and some of them can be translated into monetary values. And how do we decide this? It's basically a question of, is it about money? For instance, if you recommend that the government improve coordination among ministries, this is something that we cannot, of course, present in numbers. This requires more work and requires more discussions and more studies, for instance, and it has nothing to do with the money that the government needs to provide. And the second point, if it's about money, is the data available? Is the data, do we have the data now to process the costing exercise? Or do we need to have further look at it? Or do we need to explore further? The third one is, can assumptions be made for the scenarios? We'll discuss later on how these assumptions are made. And for recommendations such as implementing defined benefits pension system for the elderly. The RAP protocol is not designed to do the actual calculation for this. This requires further processes requiring real actuarial calculations. And of course, or do you need further studies, which supports the third question. Let me bring up some examples. This is the recommendations from Indonesia. For instance, this is not all the recommendations that we have in the matrix. I'll just take out some of them. We have, for instance, the first recommendation, development of specific and clear benefit package for the new National Health Insurance Program. The second one is the extension of non-contributory health insurance that is currently provided by the government, but only for the poor and near poor. But we would like to extend it to the whole informal economy, for instance. The third is the inclusion of treatment and prevention of mother-to-child transmission of HIV and syphilis. And the fourth is improvement of database and targeting method of health insurance program for the poor. Can you already see which recommendation can be translated into scenarios for costing? Or can you see which one is clearly not for costing and the other one is clearly you can cost? Any idea? Second one is? Yeah. So we can already see, we can already assume there are some data available, there are some numbers we can start with, because first of all, the program is already implemented. So that means we have some idea of how much the costs are, how much the contribution, and in this case, contribution paid by the government is at the moment, and the, how big the coverage is at the moment, and how much bigger do we want it to be. So there are some ideas we already have. Do you have another, do you see another one? The first one. Yeah, the first one is pretty much debatable. If you have the data and a clear idea of what the benefit package should be, then yes, you can cost it. In the case of Indonesia, because Indonesia is currently reforming its social security system, they are now making these packages, and it's a big work, of course. We decided in the end that because it's being done by a team set up by the government, and there's a long discussion with the parliament and with all the line ministries about what the package should look like. So in the end, we did not do the design of the package, and in the end we took their assumptions and the cost that they came up with and just cost based on that. Now, the third recommendation on HIV is not part of the costing the government is doing. Because at the moment, treatments for HIV are under a global fund, but they may not be in Indonesia for too long, and we see the urgency of including HIV, and from inputs from some colleagues from WHO and the UNAIDS, we should also include syphilis in it because it has as much impact and the cost is quite low. We decided that we need to cost this to show to the government how much it will cost. On top of the package that the government is designing at the moment. So this one we decided we can cost and we should cost. Now the second example for guarantee for children, we have first to expand CCT program to more areas and more recipient households, because at the moment CCT is covering around 2 million and it's increasing to 3 million households, and the number of poor households with children or pregnant women is higher than that. The second recommendation is explore the merging of CCT and scholarship program. This is because if you've seen our matrix, you will see there that basically the CCT program and the scholarship for the poor program has exactly the same type of target beneficiaries. But they're run by different ministries, and within the ministry by different divisions in the ministry, and they're both cash transfers basically. So the same program more or less, same beneficiary, different implementers. So the second one is to explore the merging of CCT and scholarship program. So this is a lot of coordination and political processes. The third one is to explore and calculate the cost. Well, this is quite explanatory. Calculate the cost of Universal Child Benefit Program. Instead of CCT, for instance, which is only targeting the poor, then we'd like to also see how much it costs if we have a universal child allowance. And the fourth recommendation is to improve management efficiency of Raskin food program. Raskin is a food subsidy program which subsidizes rice for the poor. And we found during the assessment that it has a lot of mismanagement issues and efficiencies issues. Can you already see which ones are forecasting? Number 1 and number 3, of course. Because of course number 2 is very political and administration, a lot of administration issues. And number 4, of course, it's even beyond what we can do for the government. For working age, I took here from the matrix 2 recommendations. First is to conduct a feasibility study for unemployment insurance scheme and linkages with employment services, because unemployment insurance is currently non-existent in Indonesia. Instead, we have the severance pay. And the second is to develop a public employment program linked with skill development for workers in the informal economy. Which one is forecasting? One, yeah, that's also a similar case as the first recommendation of health. Because an unemployment insurance program, a new program, if we would like to implement it, requires a bigger work of actuarial studies and other feasibility studies, of course. So we decided this is beyond what the RAP protocol can calculate. So that's why we put here, conduct a feasibility study, which also include actuarial studies and so on. But the second one, because Indonesia has already a few training programs, and this recommendation has 2 parts basically, public employment program and skill development program. For public employment program, we can make some assumptions such as if we want to pay in minimum wage, and we have a number of minimum wage. We have a number of, more or less number of workers in the informal sector. We have, on the other side, is the skill development, and Indonesia has some training programs already going on, although it's not systematic. So we can combine data from both and make a calculation based on it. So this one we did. Now the last part is elderly and people with disabilities. Yes?
Can I ask why number 1 is also not costable?
Okay. Yeah, this one. It's not possible, but because the data we need requires a bigger work. You will see later this afternoon after lunch what the RAP protocol that we are using. RAP is Rapid Assessment Protocol. Of course, it doesn't have all the requirement for comprehensive actuarial study. The first one is very costable. Should you do an actuarial study? Yeah. Okay. Back to the last part of the recommendation. Recommendations I took are first extension of non-contributory minimum pension scheme for the elderly and people with severe disability. At the moment, the government has pilot programs providing minimum pension of 300,000 rupiah, around $30, slightly above minimum wage. Slightly above poverty line. For people with severe disability and elderly without family support, or vulnerable elderly. But the program is now covering a very small number of people that are in need of this assistance. So we recommend the government to extend the program to all elderly and people with severe disability. Elderly within the definition of people with severe disability. The second one is to do a feasibility study of a defined benefit contributory pension scheme for formal sector workers, which is now taking place in Indonesia in line with the reform. Because earlier we did not have a pension scheme for non-government workers, and now it will be extended to all formal sector, and this is taking place. And the third one is creation of sound database for disabled people to facilitate targeting. You can already see which one, yeah. So basically, the extension of non-contributory minimum pension for elderly and people with disability, we have an idea of the data available and what to do. The second point is similar to the previous